expect in
What
psychotherapy?
to expect before going to therapy? Be open to the idea of change.
Yeah.
Answer is, what do you want
Out of
therapy? Be prepared to answer that question. You have to implement the changes or the
Outside.
strategies outside of session.
Why you go to therapy is because it's a safe place to be able to face these things that normally would bring a lot of fear.
Yeah, that you'll be surprised at how much change you can encounter through just working through those really difficult moments.
Adjusting my boobies.
Don't worry, I don't want to look.
Oh no. All our 36 viewers will see. Okay, so welcome back to another
episode of Cozy Psych.
Who are we, Celina?
We are graduate clinical psychology
psychologists
interns who enjoy talking about fun, everyday pop culture topics, sometimes about everyday topics, through the lens of psychologists in training. We are graduate clinical psychology interns.
Currently, candidates.
Yeah, we're
'cause we
about
just-
to candidates for graduation
Yeah, because
already.
we passed our comps. Yay! If you want to see our video on that, it's over here.
It's over there. And we will be we're just in the process of completing our theses.
Just a little bit more, baby.
A little bit more, and when we will take the board exam. All right, so if you guys want to join us along on our
the journey, please
and
like and
join our
subscribe.
cozy community of talking about, fun, educational things in a not so educational feeling way, but still educational. I don't know,
It's a lot of educational. Get that out!
No.
Okay, anyway, so what do we want to talk about today? We want to talk about some things maybe you can expect before you go into psychotherapy for all those people out there who are looking for help. But before we do that, is it?
You know what time it is?
What is it?
We always kind of forget to do our intro.
I know.
It's tea time.
It's jammy time. Cozy Psych time.
Yeah, you.
Let's go. Okay.
All right.
What to expect in psychotherapy?
What to expect before going to therapy? These are things that maybe you want to have in mind before, or maybe you're thinking about going to therapy and you're wondering, well, if you're thinking about going to therapy and are hesitant about it, definitely check out our last video.
Yeah.
That's like
we have some myths. We talk about some myths about psychotherapy. It might help you bust some myths that you may have, or just indoctrinated stigma.
Yeah,
that's totally understandable.
So definitely check those out. But today we are talking about, what if you're kind of like open to going to therapy or thinking about it, then these are some things you might expect about the process. Now,
What is the first one?
Our first one is
Not all
therapies or therapists will be suited
effective
to you.
for you.
Or effective for
Yes,
you. Now, what
so-
do you mean? What do we mean by that, Bells?
Okay, starting with therapies, because we said therapies and therapists. So, therapists and therapies, they are different. They're different ways of therapizing.
Different
Yeah,
types of therapeutic techniques or frameworks.
So therapists have different specializations. The same way doctors maybe they specialize in the heart, they specialize in the brain, they specialize in butt pain. So there are different kinds of pains.
Okay,
and there are different specialties.
Someone has been experiencing butt pain.
It was the stress from coughs. So therapists have different specializations, and they can specialize in different therapeutic modalities.
Yes, or orientations.
So they can be. So there are different types. Just to name a few that are maybe popular: CBT, psychodynamic, so psychoanalytic.
Psychoanalytic
Maybe
therapy,
you've heard about
maybe
that. From all your Freud research out there.
Yeah, or if you want to do connecting with your inner child, that's kind of also psychodynamic in a way.
There's also hypnotherapy.
Right?
So I personally took that class and I really enjoyed it. It's been really great. You don't actually steal anyone's bank account by hypnotizing them. That's not how it works, apparently. Sadly.
Yeah.
There's also existential therapy.
That's unethical too.
Aww.
Sorry, babe.
Existential therapy. There's also person-centered.
Yeah, person-centered therapy.
So
there's
Rogerian.
Play therapy. There's so many types of therapy.
So it depends on what you're looking for, right? If you're looking for you are having a relationship problem and you're looking for long-term kind of work, right? But you go in for CBT and maybe that will be a lot shorter, or maybe brief psychological therapy or psychotherapy. You're gonna find your therapist is gonna be really is only going to schedule a few sessions with you, and maybe that won't work for you.
Yeah.
So you have to understand that. You have to understand what you're looking for.
Yeah,
right?
yeah. I think a quick Google search, of course, Google doesn't tell you everything, but it gives you an idea of maybe what type of therapy would work for you. Like you could,
Existential, for example, really focuses on your meaning,
yeah,
your why.
meaning, like for people who are undergoing grief. I think it's
super helpful. For family therapy, that's really focused on like the family dynamics.
If like issues within the
your
family, couple therapy. If you have couple issues, go to a couples therapist,
sex therapist. They also help you to be able to be more effective.
For people with
build your marital relationship maybe.
And for people who are really like experiencing very clinical like types of disorders, very severe types of maybe depression, anxiety, you might CBT is one of the like, the most evidence-based type of therapy for those types of things.
A lot of research
to manage your
evidence.
To manage those types of symptoms.
So
but like aside from there being various therapeutic orientations or frameworks, there are also, even within a single therapeutic,
there are different styles.
There are different therapists.
The therapists themselves, right? Something that we've talked about, me and Celina, is we noticed that some people tend to want answers immediately. And some people just come into therapy just wanting to explore themselves, right? So there are therapists who are more focused on
more directive in a way.
Right? I will give you the answers and I will help you by giving you the answers.
Yeah, so that could be like a solution-focused type of therapy.
So maybe if you're that kind of person, you want the solutions immediately, you don't really have the time to spend exploring yourself, then maybe that's something you can look for in your psychotherapist. If you're gonna find a center, maybe request for someone who's more solution oriented.
I mean, and also like it's a personality fit too. So don't be discouraged if, let's say, you're matched to a therapist or you go to a therapist for the first time and maybe you're not really the connection isn't really connecting.
It's not doing the thing.
You don't feel a connection in an ethical way, in a therapeutic way,
and that's totally understandable. Right? Because in the end, like, connection also really matters. It's part of our practice and our journey to really build the capacity to connect with our clients.
To build rapport, but at the same time, not, you won't connect. Sometimes it's not a right.
Yeah, it's not a given.
Yeah.
It's not just like expected. Sometimes it won't work, and that's fine.
And that's okay. Like don't be discouraged. You can try again. There's so many different types of therapists and therapies. So like I think one of the best things you can do is get recommendations aside from searching online. Like ask friends who go to therapy, like what their experience is like with their therapist. You get an idea of what the personality of your therapist is, and see if that's okay with you. All right.
Okay, so for our next one, our
second point was we have to be open to the idea of change. Like, so at least open to. So I usually when you go to therapy, of course, there's you might be a little hesitant to explore certain things, to even like consider the possibility of change, but at least the openness to perhaps consider changing not yourself, not your personality, but rather
like adapting new ways of being coping, that will help you, right? So to improve your well-being, or you improve your coping strategies, or your that will help you in your everyday life, right?
Yes.
So that's what we mean by openness to change.
Yes.
Help you reframe the way you think, because sometimes we do tend to think negatively, especially if we don't catch it, right? So these are things that we can help you with. And if you're open to change, then you might be able to do them yourself outside of the therapeutic space.
Exactly. All right.
For our next one.
For our next point, what else to expect before going to therapy is, kind of
what are your
reflect
goals?
On what your goals are for therapy. Why are you Why do you want therapy in the first place?
Or maybe you don't want it, but why do you feel like you might need it? Right?
Yeah, like whether it's to get a solution, arrive at a solution to a problem, get more insight about how your past is affecting you right now, your childhood, your family relationships, etc.
How will therapy help you?
Yeah,
and what do you want?
How do you want therapy to help you? Exactly. The answer is, what do you want
out of
out of therapy.
right? So, and that's something that we also really do our best to fulfill. We want to be able to help you in the way that you need.
Yes.
That's something we ask our clients, right? What do you need? What do you want out of this?
Exactly. Yeah. So at least be prepared to answer that question going in.
Yeah.
And next is, the work. You have to expect that the work happens. Most of the work
Most of it
happens
happens outside
of the sessions. So in session, the purpose of sessions is to kind of introduce, probe into certain experiences, probe into your thought processes, your existing patterns, etc.
Essentially, to understand you, right? Because in the end, we are separate beings. We're two separate people, and we won't know what you're thinking and how you are as a person if we don't talk. We don't understand.
Yeah, that's necessary.
your
We have to get to
patterns,
know each other
right?
and build the therapeutic alliance or the therapeutic relationship. But, a lot of the times, the things that you learn in therapy, within the session, in order for it to be a source of lasting change, you have to implement the changes or the strategies outside of sessions. And that's very hard to do. It can be.
We can give you a lot of tools, right? But if you don't really use them outside, it doesn't really help. We want to bring that outside of the session because we came into psychotherapy to be able to do better in our outside life, right? So we have the responsibility to be able to utilize the tools that we were given.
Yeah. Just like, for example, if you're a diabetic going to the doctor, and the doctor prescribes you a certain, aside from medication, but like, certain lifestyle modifications that you need to do in order to keep your blood sugar down, it's not really going to mean anything if you exit the session and you don't take your meds.
You do the same thing.
Yeah. And you eat, donuts every single day. So our last point, what else to expect before going to therapy is, lastly, and perhaps most importantly, expect to feel resistance. And by resistance,
what do we mean by that?
We mean it's like you'll feel a bit of, sometimes you won't want to go to therapy. Sometimes there are a lot of like painful things that come up during sessions, outside of sessions that you remember that you might want to keep down. You might want to keep repressed. That you might not want to.
You don't want to deal with
address.
it anymore because you've dealt with it already in your past. You talked about it in therapy. You don't want to bring it up again. It's hard.
Yes, and by the way, it will happen. It will happen. Resistance will happen. But a good therapist, I think, will also encourage you. At least my therapist also used to encourage me that when you feel resistance, when you feel like you don't want to go, it's the last thing you want to do. It's how you know it's the most important thing. One of the most important things to do is to actually go and face what, the difficult emotions, difficult thoughts, experiences that are arising in your everyday life.
Yeah. I agree.
Right? And the resistance can happen due to like many things. When you start remembering things, maybe there's a bit of transference happening. You're projecting a lot of, those like difficult feelings that you feel towards a certain person in your life, towards your therapist. And that naturally occurs, by the way. That really occurs. But it's so important, all the more important, to go to therapy and work through those difficult feelings as they arise, because that's where true therapeutic change happens. When we face the resistance, we face the fear, and learn that it's not so scary, it's not so difficult, it's not impossible to work through.
Yeah. Again, in the end, the therapeutic space, why you go to therapy is because it's a safe place to be able to face these things that normally would bring a lot of fear.
Yeah.
Right? So, of course, these aren't the only reasons people come into therapy. That's something that just you have to know.
Yeah.
Right? But for some people who come into therapy who have some fears that they struggle to face, right? You come into it because your therapist is someone who won't be there to make it difficult for you. They're not there to judge you. They're not there to bring you down and shame you for feeling these things, right? It's a place where you can openly feel the fear, but in a safe environment.
A safe space. And that in itself is therapeutic. And you'll be surprised at how much change you can encounter through just working through those really difficult moments. Yeah. So,
I think
that kind of sums up what we wanted to talk about today.
Yeah.
It can be a scary process. I know when I'm seeing a client for the first time, how if I'm a little nervous seeing a client for the first time, I can only imagine what they're feeling too. I've been there. I was a client too. and it can be scary. It can be scary to talk about everything that's happened in your life, all of the bad and scary things, the bad and scary things, to a total stranger. But it's a gradual process of building the rapport, building the therapeutic relationship, and just, trust the process.
Yeah. I do agree that going through like my internship, I have met a lot of people. They really come in for the first time and they've never experienced psychotherapy, and it's a scary thing. But the thing is, there are different types of therapy. It doesn't always have to be immediately clinical therapy or psychotherapy. There are also services like psychosocial support, right? Those are free services out there that they provide. So it doesn't have to be as serious as psychotherapy immediately. Maybe you can even look, if you're just looking for guidance or motivation, you can look for life coaches.
Yeah, peer support sessions. Like group sessions where you guys talk about things or
learn
challenges.
from each other's experiences. Group therapy. So these things, you don't immediately have to go, if you're afraid to go immediately into psychotherapy, you can look for peer group sessions, you can look for psychosocial support. So it's not immediately like we're here to fix you.
Yeah, if you're going into therapy with that kind of expectation. And I think another important thing that you can do if you're a little scared is go talk to people who have been through therapy. I'm sure they have a wealth of insights and anecdotes that might resonate with you.
So thank you so much for staying this long into our video, and I hope you have a cozy
week and day and year ahead. I hope you spend it with us too, so don't forget to like and subscribe, please. Subscribe to our cozy community. Bye. Why don't you ever complete my heart?